So you're walking, you build your collaterals. Does an ABI after, like, let's say you're walking normal without pain, would an ABI after 3 months show that you have P.A.D, or do you need other tests?
So an ABI can still show you if you get a full ABI. So ABIs can be done a couple different ways. It can be just where they check your arms and your feet, or you get the ABIs that look down your leg at different levels. And you can see the wave changes and the pressure changes as you go. So you can see the difference. What we care about at the end is if it's a reliable ABI, has it improved from your baseline? Or if you don't have a baseline, where are you at right now? Regardless of the numbers, we should treat you based on your symptoms.
Yeah, but if you have no pain, how would, I mean, would it, that's why I asked, if you have no pain anymore because you walk yourself to a good point with collaterals, you know, how can a test determine that you're, an ABI test determine that you have a real problem in your main artery?
So again, your ABI could be less than perfect and tell us that there's disease, but your symptoms aren't there. So we wouldn't focus that. We wouldn't try to do anything anyway, but we'd monitor you. If something was suspicious on an ABI, we would get a duplex to look at the arteries themselves.
Okay.
So if you're not in pain, again, no one should be touching you unless you have a wound or something else, because everything you do once you touch you starts the cycle. We try to treat something that's affecting your life without doing something unnatural to your body. That should be the goal. That doesn't happen all the time and everywhere, but if it's not affecting your life and you're able to fight through it, and what Kim teaches you guys and fight and promotes for you guys is walk, because the best thing you can do is walk away from the hospital. That's kind of the best thing. Like, walk towards it, but if you're just walk away, because once you get in and once you have a procedure, you're starting the clock, no matter who does what, surgery or endo or minimally invasive, or we're just going to do a little oil change touch up. It's not a Tesla, and I don't know if those are good either, but
so the question that a lot of people always ask, and I think it's kind of what Heinz, you can correct me if I'm wrong, I think you're getting to, is does the ABI actually show improvement in the numbers with collateral growth?
Yes.
Right.
So, but to know that, you would have to have kind of a baseline when you're having problems in the beginning. So if you have claudication, typically your ABI, if it's a trustable ABI, because if you have calcium, sometimes we can't rely on that. But if you have a trustable ABI, let's say, and I always tell patients, think of it as a percentage. If your ABI says 0.8, think of that as 80%, which is like a B when you're in elementary school. So you have 80% of blood flow from your heart reaching your foot. And then let's say you work through it, you do your medications, you work on your diet, your diabetes, and you're walking. We see patients that get to 0.9, 90%. Now you have an A. Is it going to be 100? Maybe. But again, the key is, did it improve without us touching you? And even if it's blocked, completely blocked at one segment, you can form good collaterals, juicy, big, or large collaterals that will bring your ABI up. Now, will it be perfect? No, but the number doesn't matter as much as how far are you walking? How's your pain? Are you carrying out your job, your life, your self-care? That's what matters the most.
And Marcia wants to add a note in there. Marcia, go ahead and unmute.
Oh, I was just going to say, Heinz was asking about the collaterals. Well, we know I'm 100% blocked again, even with a full metal jacket, so to speak. But my ABI reflects that I have decent blood flow to my foot. So that has to be from the collaterals, right?
Oh yeah, if your full metal jacket was down and your leg is still on, that means you have collaterals.
Right.
If you didn't have good collaterals when those went down, your leg would have been purple, blue, and cold and in the ER. So your collaterals keep you from completely becoming an emergency.
Right.
Yeah. And that's usually the profunda artery, the deep femoral artery, the one in the groin that we try to avoid messing with. Because when things go down, that's the artery that's your lifesaver.
Oh, okay.